Hello, everyone. My name is Imonitie Okhiria, and I'm going to take you through my journey and give you a little bit of insight about who I am and what I do. So, I am a first generation African American. My parents are from Nigeria, and they migrated to America and settled in New York. So, New York, baby. I've been in New York practically all my life. Went to undergrad at the University at Buffalo, where I obtained my bachelor's in health and human services. And then I also went to LIU and obtained my master's in public health, health advocacy and leadership. From there, my wife and I, who's a Georgia native, decided to relocate to Atlanta. So here I am. Had a fabulous opportunity to work with Grady Hospital, which is an amazing hospital. What I do, I am the ambulatory practice administrator, which is a leadership role within our outpatient services. What I do, I oversee several outpatient clinics, and I help bring to life the strategic initiatives of leadership. I also have a fantastic job where I lead amazing crew of healthcare people, clinicians, physicians, and I work collaboratively to meet the goals and values of the organization. We're able to do that. And at the same time, we're able to help people who are in need one way or another, help to improve their quality of life and help to improve some of the illnesses that they may be having or experience. And that's a little bit about what we do. There's some day-to-day operations, finance, recruiting, just basically building up people to accomplish their goals. And that's what I do. Uniquely, I was able to gain some exposure into the health system through my father. So I quickly, I guess, must have had some some innate leadership skills passed down from my father. My father was also a healthcare executive, more so in the long-term care sector of the healthcare system. I was able to shadow him while he was, leading his team, and that's how I got my first foot in the door as well. Just sort of getting that exposure and learning how to be a leader and what it takes to be a leader and lead a team of people. I also, at that time, I guess I would say it was sort of a roadblock on what I truly wanted to do. Because on one hand, I had ability to lead people. On the other hand, I had also a passion where I wanted to be a physician. And, I played my hand into both sectors, but one naturally just came very easy to me, and that was being a leader and just knowing how to relate to people and how to, literally think outside of the box, be creative, and knowing how to accomplish things. And so once I decided, you know what, this is literally staring in my face, I just went full steam ahead, and ever since then, I've been excelling in my career. So I've started out from a manager, and now I've worked my way up into a director level position. And that's sort of how I, got to my career path and what I'm doing now. It has been challenging at times, just dealing with people and trying to carry out strategic initiatives, especially during this time with COVID. It has been very fluid and dynamic in what we've done, particularly in my area, and just starting out new initiatives, testing for COVID, and then also screening. And now we're doing a mass vaccination campaign, which has been fun too. Just seeing people's face light up when we're able to, get them in for a COVID-19 vaccine. So we've done some great things at the organization. The organization I work for is just really, really innovative and great. So it's been very rewarding and very fulfilling. Some of the things that I do outside of work, where I find a purpose as well, is just trying to build up a legacy for my family as well. And I'm very into passing down generational wealth. So one way that I feel that I can do that for my family is through real estate. And my wife and I have taken on this venture where we've developed some new construction property, and we've turned that into rental property, and we'll pass that down to our children, so they can, build generational wealth and pass it down to their children. One advice I would give to anyone looking to get into the healthcare sector or into leadership role, truly get some exposure. And I think that's one of the things that helped me, was that I was exposed to the healthcare world through my father. And it doesn't necessarily have to be anyone that you know, but there are also volunteer opportunities and organizations, and many healthcare organizations in Atlanta. And I would encourage anyone to join the summer volunteer programs that many organizations have. We have one at Grady as well. And that will help you to gain, a foot into the healthcare system, see what we do, see how it runs, see all the different roles, how they play a part into caring for patients, and what area may spark your interest. And you'll be fascinated to see that you may have one idea of what you think you want to do and end up leaving with a whole new aspirations on what you would like to do in the healthcare system. It is very vast and robust. So that's a little bit about who I am, and thank you for listening to me. Have a good day.